Growth hormone deficiency, GHD, is a medical condition in which the body does not produce enough growth hormone, GH, a crucial substance secreted by the pituitary gland that stimulates growth, cell reproduction, and regeneration. GH is essential for physical development in children and helps maintain body structure and metabolism in adults. A deficiency can occur at any age and may be either congenital, present at birth, or acquired later in life. Causes of growth hormone deficiency. GHD can result from a variety of causes. In children, congenital GHD may arise due to genetic mutations, developmental abnormalities in the pituitary gland, or structural defects in the brain such as septo-optic dysplasia. In many cases, the exact cause is unknown. Idiopathic GHD. Acquired GHD, more common in adults, can result from pituitary tumors or hypothalamic tumors, example craniopharyngioma. Head trauma. Radiation therapy for brain or head and neck cancers. Brain infections such as meningitis. Surgical damage to the pituitary gland or hypothalamus. These factors may interfere with the normal functioning of the hypothalamic pituitary axis, disrupting GH production. Signs and symptoms. In children. Children with GHD often exhibit slow growth and may be significantly shorter than their peers. Key symptoms include slowed or delayed growth rate, less than 2 inches per year after age 3. Short stature with normal body proportions. Delayed puberty or absence of puberty. Increased fat around the abdomen and face. Immature facial features. Poor development of hair and nails. GHD may also be associated with low blood sugar, hypoglycemia, in infants and delayed tooth development. In adults. Adult onset GHD manifests differently than in children. Symptoms may include decreased energy and stamina, reduced muscle mass and strength, increased fat mass, especially around the waist, elevated cholesterol levels, osteoporosis and increased risk of fractures, depression and emotional instability, impaired memory and concentration, poor quality of life. Since these symptoms can overlap with other health issues or natural aging, GHD in adults often goes undiagnosed. Diagnosis. Diagnosing GHD involves a combination of clinical evaluation, medical history, and laboratory tests. Simple blood tests for GH are not reliable because the hormone is released in pulses, making random levels inconsistent. Tests used include stimulation tests, the most definitive diagnostic method. GH release is stimulated using substances like insulin, arginine, clonidine, or glucagon. If the GH response is below a specific threshold, GHD is confirmed. IGF-1 measurement, insulin-like growth factor 1, IGF-1, levels reflect overall GH activity, though low levels alone are not conclusive. MRI scan, imaging of the brain and pituitary gland can identify structural abnormalities, tumors, or other causes of GHD. Growth charts and bone age tests, in children help determine if growth delay is due to GHD or another cause. Treatment. The main treatment for GHD is recombinant human growth hormone, rHGH, administered through daily subcutaneous injections. Dosage is tailored based on age, weight, and individual response to therapy. In children, GH therapy can significantly increase growth velocity, allowing children to reach near normal or normal adult height. Early diagnosis and prompt treatment are crucial for optimal outcomes. In adults, GH therapy can improve muscle mass, reduce fat mass, increase bone density, boost energy levels, and improve emotional well-being. However, treatment is only recommended for adults who meet strict diagnostic criteria, due to cost and potential side effects. Side effects and risks. GH therapy is generally safe but may include side effects such as joint and muscle pain, swelling, edema, carpal tunnel syndrome, insulin resistance or increased risk of diabetes, headaches and possible intracranial hypertension. Children may rarely experience scoliosis progression or hip problems, slipped capital femoral epiphysis. Monitoring by a healthcare provider is essential throughout therapy. Prognosis. With early diagnosis and proper treatment, children with GHD can grow normally and lead healthy lives. In adults, GH replacement can significantly improve quality of life. However, lifelong monitoring is often needed to adjust hormone doses, assess growth progress, and manage any side effects or associated conditions. Conclusion. Growth hormone deficiency is a complex but treatable disorder affecting both children and adults. It may stem from congenital or acquired causes and presents with diverse symptoms depending on age. Prompt diagnosis using stimulation testing and imaging, followed by appropriate GH therapy, can restore normal growth in children and improve overall health in adults. With ongoing medical management, individuals with GHD can lead fulfilling and productive lives.